Recommendations regarding fillers and Botox for a 45-year-old woman who prefers a very natural look. Budget is $2,000. I have an appointment with an Oculoplastic board-certified plastic surgeon to get filler in my tear troughs. He comes highly recommended. I feel confident about his abilities, but I have questions about treatments for my forehead and lips. Regarding my forehead, can I get Botox in just my 11s and not the rest of my forehead? Or could I ask to get a natural-looking forehead instead of the smooth-as-glass look? For my lips, what's best to lessen these lines and restore volume and address asymmetry?
Thank you for your question. You were very detailed in your question and stated your situation. You're going to a board-certified oculoplastic surgeon to have the treatment of your tear troughs, and then in addition you want to ask about treating the forehead with Botox and what's the best recommendation for your lips. Well, it is likely also, just as a side note, that your oculoplastic surgeon should be able to help you with those areas as well. Botox was one of the oculoplastic surgeons were one of the first to use Botox long before it became used for cosmetic reasons. So I've been using Botox for patients since 1993. Now I am also trained in facial cosmetic surgery, boarded by the American Board of Cosmetic Surgery, and so I do a lot of facial work as well. I would also say that as far as just commenting on the concern about Botox and whether to do the glabella or the number 11s or to do the whole forehead, you certainly have that option. And so we'll just isolate that area. From my perspective, one of the best areas to treat in the forehead is the number 11s. It has such an impact. This set of muscles called the corrugator and procerus muscles really affect overall facial appearance. So if you're someone who always thinks critically and looks at something and frowns, then the number 11s being treated with Botox, Dysport, or any of the other neurotoxins can be tremendously effective. You can certainly do that in isolation without doing the rest of the forehead, so you don't get the over smooth look as you described it. It's very individual. Examination really helps determine that, and you can take little steps. You can do just the number 11s and maybe try the forehead at another time. As far as the lip lines are concerned, in our practice we generally treat the lip lines with a hyaluronic acid filler, whether it's Restylane or Juvederm. The lip lines can be tricky because there can be deep lines and there can be fine lines and even crisscross superficial lines. And so the other options also can be entertained. We also, besides using fillers to restore volume for deeper lines, as well as to create a nice contour of the lip border, we also use something like fractional CO2 laser or some type of resurfacing modality. We've also used microneedling as well as the use of something called platelet-rich plasma. Platelet-rich plasma is using your own growth factors to derive from your blood. That's basically the concentration of the necessary wound healing factors taken with a simple blood draw, and using that to build up collagen. What you're describing is volume loss, and volume loss in particular at the layers of the dermis, the backbone of the skin. And so there's a lot of different options, and it all depends on what will define a satisfactory outcome for you. I know you put down a number, a budget that's right, that you want to work with, and I think that as we do every day in our practice in Manhattan and Long Island, people come to us with a long list of things they want to do, and then we figure out based on priorities and what they can afford, what they are able to do at the time, what will give them the most value and based on what is most important to you. So That being said, I think you can certainly just discuss this with the oculoplastic surgeon, and your doctor, I'm sure, will be honest about what they're comfortable with. But I wouldn't be very surprised. Oculoplastic surgery really now is oculofacial plastic surgery, and most people trained in oculofacial plastic surgery are trained in doing facial cosmetic surgery, and it is common for oculofacial plastic surgeons to perform facelifts and do other things beyond the limited area of the eye. So I think you might be able to get everything at one stop and learn about your options at one place, and that's kind of a nice thing when you don't have to go piecemeal to different people. So I hope that was helpful. I wish you the best of luck, and thank you for your question.